My name is Dr. Alan Gabriel. I'm a board-certified plastic surgeon practicing in Vancouver, Washington. When considering Prevena Therapy, my advice is to think beyond the incision. Instead, consider the whole patient and the need for both incision and soft tissue management. Here's an example where we helped a very high-risk patient with Prevena Therapy using the 3M Prevena Restore Therapy system. A 43-year-old woman had a heart attack that required immediate catheterization leading to a 4-vessel CABG. She had coronary artery disease, diabetes, and end-stage renal disease on dialysis. On top of all that, she had developed a sternal wound infection requiring debridements that led to loss of her entire sternum. This area is not conducive for a skin graft, so this requires sternal reconstruction with a muscle flap. In this case, the right rectus muscle flap was performed to reconstruct her sternal wound, followed by delayed primary closure. The surgical challenge is that we are dealing with a higher BMI patient with large breasts that may lead to surgical site complications. Post-operatively, there is going to be a lot of edema and tension at the incision site. Therefore, this wound may have a higher chance of breaking down. Traditional Prevena Therapy dressings in this area would support the incision, but because of the additional tension on the incision and extended edema, I needed more soft tissue management in the area as well. So I used the extended coverage 3M Prevena Restore Belliform dressing to manage the soft tissue surrounding this incision. Isn't it fitting that Prevena Restore Belliform dressing has a heart shape to it? I like to comfort my cardiothoracic patients by saying they will wake up with a beautiful purpled heart on their chest. I would have even used the Prevena Restore Belliform dressing on the belly if it was the appropriate length. With a pannus that large and the length of the incision, there's a high risk of incisional dehiscence as the pannus falls towards the right or left depending on the patient's sleeping position. So I used a 3M Prevena customizable dressing where I covered the entire closed incision from top to bottom. And at 2 weeks, I was excited to see that the incisions were looking great. I didn't see any necrosis or drainage. So every week, she had her Prevena Restore Belliform dressing and Prevena customizable dressing changed. This continued for 3 weeks for a total therapy time of 4 weeks. I could see the soft tissue management with Prevena Restore Belliform dressing was working well, so I continued this therapy for 30 days. After 4 weeks of Prevena Restore therapy, coupled with teamwork and great medical and nutritional management, the patient was able to transition to out-of-the-hospital care. This shows that optimizing a high-risk patient like this, one may allow technologies like Prevena Restore therapy to work well. If a wound edge is questionable, why take chances? Think beyond the wound and look at the whole patient to optimize their care with Prevena Therapy.